This activity is the Feely bag. In the booklet, it's on the page that says Professor Fluffy's Medical Cluedo. So turn to this page in the booklet and get all the kids on your table to turn to this page as well. As you can see, it's a table, 9 body parts, and it's got the 9 body parts pictured around. So basically, what you do is, there's a blindfold on the table as well. Get one kid to put the blindfold on, or ask them to close their eyes if they don't want to put it on. Some kids don't want to, so you don't have to use that. Get them to close their eyes. Get one of the children to put the hand into the bag, get hold of something, but make sure you emphasise not to take the hand out, because a lot of the kids will automatically go in, grab something and pull it out. So make sure you remind them quite a few times before you start to keep the hand in the bag once they've got hold of an object. Get them to get hold of an object in the hand. They can pick any of them that they want. And then everybody else on the table has to ask the questions down the side here. So is it hard or soft? Is it rounded? Long or short? Smooth or rough? And does it make a noise? There's only 2 objects that make a noise. They're the lips and the nose. The nose snores and the lips make a kissing noise. And they make the noise if you squeeze them. So for the last question, tell the pupil who's got the hand in the bag to squeeze the object, and if it makes a noise, then it's one of those. Basically, as you go through, what you're trying to get the kids to do is exclude the ones that can't fit. Now, not all of them fit perfectly, but most of them do. So hard or soft, rounded, long or short, smooth or rough, and then get them to have a guess at the end. And they can all sort of say, is it a foot? And someone in there might say, no, it's definitely not, because it feels different to that. When they've all got a guess and when they think they know what it is, the kid can take the hand out, they all have a look at it, and then they write the answer there, and then they can cross it off from there. Pass the bag round, let everyone on the table have a go, and obviously once you've used an object, leave it out on the table. There's 9 objects in total, so there should definitely be enough for a go each for the kids, and possibly 2 for some of the kids. Obviously, again, you can run through the function of some of these, but they're not all particularly difficult. So they're the 9 objects. Obviously an eyeball, which is round, and is really the only rounded one apart from potentially the kidney over here. But because it's perfectly round, on that question, if you say, is it perfectly round, then you might say yes, and you say, right, which one could that possibly be? And obviously it can only be the eye. Ears obviously a funny shape, so they might describe it as quite bumpy and a bit of a funny shape. Teeth, which are obviously on there again. This is one of the ones that's a bit strange because they are a bit soft, and obviously a tooth wouldn't normally be soft. But obviously there's nothing we can do about that. Lips and nose, they're the ones that make noises when you squeeze them. The heart, which is quite a detailed heart, so it's got quite a strange surface because it's got all these vessels coming out of it. So they might be able to pick up on that and say that it's quite bumpy again, and pick up on these veins as well on the surface. Bone, which actually is quite hard, so that one they should be okay with. Foot, which again has a distinct shape. And then the kidney is the only one that they probably won't know. This commonly gets confused for a heart, for a stomach. But if you explain it, that it's on there already at the beginning, and then obviously you can see that it's a very similar shape to the diagram in the book. That's it basically. You go through and they have to pick which ones they are.